Up first this evening, the Health Ministry is reporting 5 new confirmed COVID-19 cases. This brings the number of confirmed cases to 478. Now, Health Minister Dr. Christopher Tufton provided an update of the number of confirmed cases as well as recoveries at a virtual press conference earlier.
The last 24 hours, we have seen 5 additional persons testing positive for COVID-19, which brings our numbers now to 478 confirmed cases on the island. One of the new cases is an 18-year-old male from St. Mary, and he is a contact of a previously confirmed case. The others are 3 men who range in ages from 18 to 69 years, and 1 woman who is a 17-year-old. Additional cases we are pending as the test results continue to come in. It's a very fluid situation. Of course, we will keep you updated as we get that information. So we have in the last 48 hours had 8 more persons recovered from COVID-19, the procedure being 2 negative tests within a 48-hour period, having had an initial positive test. The total number of recoveries are 57, and we continue to monitor the others. For the most part, these individuals are showing very good signs of recovery. In fact, I don't think we have anyone now in a ICU setting, but the CMO can correct me. I'm told no, which is important.
Now to the issue of the BPO sector. The sector was ordered shut on April 23, except for certain critical services after an outbreak of COVID-19 at the Alorica call center in Portmore, St. Catherine. Well, Health Minister Dr. Christopher Tufton provided an update on the infection prevention and control mechanism.
We have done a number of inspections. Currently, as you know, 62% or 62.5% of the 32 BPOs now in operation have passed the inspections. That's 20 of 32. The remaining institutions have been provided with work plans to improve their infection prevention and control measures. So 20 are considered satisfactory. 12 needs more work, and closure instituted by the Ministry of Health 4 fall in this category, and with some reopening dates set based on the actions that are to be taken. We have seen also in recent times improved compliance and reopening permission given to 2 additional others.
Now, last week when the Health Ministry went before the Public Administration and Appropriations Committee, PAAC, it was disclosed that the ministry had so far spent 2.5 billion of the 2.8 billion COVID-19 expenditure. Well, Dr. Tufton also said the Auditor General has expressed an interest in the matter and is expected to conduct an audit.
Of course, we have no issues with that. I think that's important for transparency and accountability, and that audit will commence, I am told, sometime next week. The executive management of the ministry welcomes the audit as a tool for effective and efficient implementation of activities and for transparency and accountability. And the public will, of course, be provided with any detailed outcome. Of course, the Auditor General has a process that leads to that kind of expose.